Cefazolin Sodium-Dextrose Solution, Piggyback Premix Frozen is an antibiotic that is used to treat a wide range of bacterial infections. It can also be used before and during certain surgeries to prevent infection. This medication belongs to the class of cephalosporin antibiotics and works by stopping the growth of bacteria. It is important to follow the dosage prescribed by your healthcare provider and take the medication at the recommended times for the best results. When using Cefazolin Sodium-Dextrose Solution, Piggyback Premix Frozen, the medication may be given by injection into a vein or into a muscle, as directed by your doctor. The dosage is based on your medical condition and response to treatment, and for children, the dosage is also based on their weight. If you are self-administering this medication at home, it's important to learn all preparation and usage instructions from your healthcare professional. Before using, visually check the product for particles or discoloration. If either is present, do not use the liquid. It's also important to learn how to store and discard medical supplies safely. For the best effect, use this antibiotic at evenly spaced times, and try to use it at the same times every day to help you remember. It's important to continue using this medication until the full prescribed treatment period is finished, even if symptoms disappear after a few days. Stopping the medication too early may result in a return of the infection. Lastly, be sure to tell your doctor if your condition lasts or gets worse. If you experience swelling, redness, pain, or soreness at the injection site after using Cefazolin Sodium-Dextrose Solution, Piggyback Premix Frozen, it's important to inform your doctor. This medication may also cause loss of appetite, nausea, vomiting, diarrhea, or headache, although these side effects are rare. Remember that your doctor has prescribed this medication because the benefits outweigh the potential risks. Serious side effects are rare, but if you experience dark urine, easy bruising/bleeding, fast/pounding/irregular heartbeat, seizures, weakness, yellowing eyes/skin, or mental/mood changes, notify your doctor immediately. Additionally, a severe intestinal condition caused by a bacteria called C. difficile may occur during or after treatment, with symptoms including persistent diarrhea, abdominal pain, and blood/mucus in stool. If you have these symptoms, do not use anti-diarrhea or opioid products as they may worsen the condition. Prolonged use of this medication may lead to oral thrush or a new vaginal yeast infection, so contact your doctor if you notice any changes in your mouth or vaginal discharge. While serious allergic reactions to this medication are rare, seek medical help if you experience symptoms such as rash, swelling, severe dizziness, or difficulty breathing. If you notice any other effects not listed here, consult your doctor or pharmacist. Before using Cefazolin Sodium-Dextrose Solution, Piggyback Premix Frozen, make sure to inform your doctor or pharmacist about any allergies you may have, especially to cephalosporins or penicillins. This medication may contain inactive ingredients that could cause allergic reactions or other issues. It's important to discuss this with your pharmacist for more information. Also, be sure to inform your doctor or pharmacist about your medical history, particularly if you have kidney disease, liver disease, or stomach/intestinal diseases such as colitis. It's important to note that cefazolin may interfere with the effectiveness of live bacterial vaccines, such as the typhoid vaccine. Be sure to inform your healthcare professional if you are using cefazolin before getting any immunizations or vaccinations. Before undergoing surgery, inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or breastfeeding, be sure to consult your doctor before using this medication. It's important to be aware of potential drug interactions that could affect how your medications work or increase the risk of serious side effects. This medication may interfere with certain lab tests, which could lead to false results. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. Also, make sure that lab personnel and all your doctors are aware that you are using this medication. And always consult with your doctor before starting, stopping, or changing the dosage of any medicines. If you or someone you know has taken too much Cefazolin Sodium-Dextrose Solution, Piggyback Premix Frozen and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, while Canadian residents can contact a provincial poison control center. Symptoms of an overdose may include difficulty breathing and seizures. This medication is prescribed specifically for your current condition and should not be shared with others. It is important to follow your doctor's instructions and not use it later for a different infection unless directed by your doctor. Your doctor may also recommend lab or medical tests while using this product, so be sure to keep all medical and lab appointments and consult your doctor for more details. Make sure to take each dose of Cefazolin Sodium-Dextrose Solution, Piggyback Premix Frozen at the scheduled time. If you happen to miss a dose, consult your doctor or pharmacist immediately for a new dosing schedule. Do not take a double dose to make up for the missed one. Be sure to consult the product instructions and your pharmacist for storage details. It's important to keep all medications away from children and pets. Remember not to flush medications down the toilet or pour them into a drain unless instructed to do so. Properly discard this product and it is expired or no longer needed. It's best to consult your pharmacist or local waste disposal company for the proper way to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.